In this video, we're going to talk about metabolic disease. So you might be wondering what metabolic disease actually is. Well, the term metabolism is used to describe the chemical reactions involved at a cellular level in converting food into energy. So metabolic disease occurs when metabolism is impaired and normal chemical reactions are disrupted. It's actually a cluster of conditions involving diabetes, high blood pressure, and obesity. And these diseases are really serious in their own right, but when they're present together, their health implications are exacerbated. There's a higher risk of heart disease, stroke, and other conditions affecting blood vessels, so it's extremely serious. In terms of diagnosis, different health organizations have slightly different definitions, but broadly it's very similar. So if you have 3 or more of the following symptoms, you're said to have metabolic disease. Firstly is abdominal obesity. High triglycerides is the second one. Low high density lipoprotein cholesterol, high blood pressure, and then a fasting blood glucose above 100 milligrams per deciliter. So you might be wondering how all of this actually links to keto. So globally, metabolic syndrome is one of the most prevalent non-communicable diseases. Non-communicable means that it's a disease that's not passed from person to person like a virus. And whilst there are genetic conditions that result in issues with metabolism, metabolic disease is primarily a result of poor lifestyle choices, specifically poor nutritional choices and lack of physical exercise. Metabolic syndrome is also linked to insulin resistance, which is a key feature in type 2 diabetes. Insulin resistance is a very complicated condition, but the simplest way to describe it is that it's where your cells become resistant to insulin. So if you watched our video on insulin, you might recall that one of the functions of insulin is to facilitate the movement of glucose into cells where it can be converted into energy. And when the cells become resistant to insulin, this process is impaired, so glucose does not get into the cells where it's supposed to be metabolized. It continues to circulate in the bloodstream, which is why blood glucose levels rise. So this is a very vicious cycle, which is exacerbated by the intake of sugars and therefore carbohydrates. So the reason that it's relevant to keto is that reducing carb intake can be extremely beneficial and has been shown to reverse insulin resistance and type 2 diabetes. Now, type 2 should not be confused with type 1, which is a genetic disorder where the pancreas does not produce sufficient insulin. Type 1 is usually diagnosed at a very early age, and the treatment is regular injections of exogenous insulin into the body. Conversely, type 2 is associated with insulin resistance, and it's caused by those poor nutritional and lifestyle choices. The ketogenic diet has been scientifically proven as a drug-free intervention for type 2 diabetes, and it's been shown to completely reverse the condition within 2 weeks. You might find that hard to believe, as the general consensus in the medical community for years is that type 2 diabetes is irreversible. Now, that's simply not true. If you want to fact check that, you might want to check out the VERT study in the US. They have got a lot of studies to prove this. We'll provide some of the links to this in the comments and you can check it out for yourself. So the ketogenic diet doesn't only benefit type 2 diabetes. In people with type 1, it can significantly reduce the need for exogenous insulin by switching to keto. These are serious conditions and this information should not be taken lightly, and it does not constitute medical advice. We're not medical doctors, so we can't support in taking people off medication. As nutritionists and health coaches, we can provide guidance and advice on nutrition and lifestyle only. However, we do work closely with a number of medical doctors who specialize in using keto as an intervention. So if you know anyone or you suffer from type 2 diabetes yourself, please reach out to us and we can connect you with those medical doctors.